A health tracking poll from the Kaiser Family Foundation says that the COVID-19 pandemic intensified mental health issues to the point of crisis. This is the Open Source TV. I'm Sharon Stevens. We'll be right back. My guest is Dr. Ziad Al-Ali, the Chief of Research and Development Service at the VA Hospital in St. Louis. Dr. Al-Ali led a study about COVID and mental health that was published in the respected British Medical Journal, and he's here to tell us about the seriousness of the issue. Welcome to the Open Source.
Thank you for having me, Sharon. Delighted to be with you.
First, let me ask you about this study. You had 3 groups of people who were involved. The first group consisted of people who survived COVID after 30 days. Tell me what happened with them.
So what we wanted to do, we wanted to investigate whether people who survived the first 30 days of COVID-19 go on to develop some mental health problems down the road. So what we did in this study is that we collected data on about 154,000 people who had COVID-19 during the first year of the pandemic. And then 2 control groups. One control group we call the contemporary control group of people who lived during the same time period but did not catch COVID-19, did not get COVID-19. And another control group we call the historical control group. Those people lived before the pandemic. And obviously also because there was no COVID-19 then, they did not have COVID-19. So we compared the COVID-19 people to those 2 control groups. And what we've learned is that people with COVID-19, a year out, a year after the infection, had increased risk of several mental health problems, including anxiety, depression, stress disorders, sleep problems, brain fog or neurocognitive decline. There was really significantly increased risk of mental health problems in people with COVID-19 compared to both the contemporary control group and the historical control group.
Now, your final group was the group of people who had mental illness. Tell me about them.
So what we found is that even a year out, even a year after the infection, people with COVID-19 were manifesting with all sorts of mental health problems, including depression. People were having, suicidal ideation or major depression. People were having stress disorders or PTSD. People were having anxiety attacks or things related to anxiety. And then also disturbingly, people were having those diseases with enough severity to necessitate the initiation of medications. We saw a lot of people on, being started on depression medications, anxiety medications, stress disorders medications. And there was also increased risk of people having sleep problems and needing to be on sleep medications as well.
So are these people who had mental illness that was just exacerbated by COVID?
No. So what we've done here is that we really tried to exclude from our cohort people who did not have, people who'd had any mental health problems in the past. We wanted to investigate the risk of incident or new mental health problems to really be able to attribute it to COVID-19. So the people that or the risk that we are measuring here is really all new mental health disorders in people who never had any mental health problems before the pandemic or before getting COVID-19 itself.
And when you talk about the anxiety disorders, how many are there?
There's quite a bit of anxiety disorders, we focused on the main ones, generalized anxiety disorders and PTSD. There was really significantly increased risk, and I think was the eye-opener here, or the thing that really was the stark finding, is that even a year out, several months after the initial infection, several months after COVID-19, these people who got COVID-19, they thought they got over it, it's behind them. Several months out, they were experiencing all those manifestations related to anxiety disorders. And the second thing that was also eye-opening in our report is that the risk was evident even in people who had mild or sometimes asymptomatic cases of COVID-19. meaning even the people who did not need to be hospitalized for COVID-19 did not need to be in the ICU for COVID-19. And that's really important because that's really the majority of people in the US. The majority of people in the US, when they get COVID-19, they don't need to be hospitalized for it. Actually, as a matter of fact, a lot of people who get COVID-19 experience it in either mild symptoms or asymptomatic disease. So even those people, and that's really important because they represent, again, the lion's share of people with COVID-19 in the United States, even those people went on to develop significantly higher risk of mental health disorders, including anxiety disorders, a year out.
What about stress? I mean, that's something that people have every day.
That's true. So the general stress that we experience every day is not really necessarily a disease state. People get stressed out. People are late to something, or a lot on their plate, a lot on their calendar, lots on their agenda. Kids are having problems, or so people get stressed out all the day. Day-to-day activities, life stresses you out. But here what we saw is really stress beyond the normal level of stress that comes with daily life. This is stress that sort of enters what the disease state, where people could label it with diagnosis, and it really impairs their ability to function, their ability to carry out their daily activities, their ability to sleep peacefully and restfully and recover, their energy and wake up in the morning fresh and happy and rested. So that type of stress is really pathologic, certainly, is a disease state, and is really way above the regular stress that people experience in their daily lives. We call, I'm stressed out today because I have like 500 things to do. It's like, okay. Yeah, I think that this is really, the kind of stress that's really much more severe than the regular stress that we experience in our daily life.
Should it be going by a different name then?
I think the formal name is stress and adjustment disorder, and that's really the clinical name. And I think it's reasonable to still call it that.
Thank you very much. We will be right back. Welcome back. Let's talk about antidepressants. First of all, were they of any value to people who were struggling with COVID?
Yes, certainly. So the people who have depression of the kind that really is severe enough to necessitate medication use, antidepressants are going to be valuable and very important in helping patients sort of stabilize their mood and get back to normal as much as possible. So certainly very valuable medications in this context. It certainly requires a prescription from a doctor, from a psychiatrist or a doctor who actually has the privileges to be able to do that, and need to be monitored over time. But certainly this could be valuable and very important in people who have, say, major depression or recurrent depression that requires medication.
Now, prior to the pandemic, America was already an opioid nation. Did that change anything?
Yes, so what we've seen is that people with COVID-19 are actually increasingly being prescribed more opioids than the control group. And that's really worrisome on multiple levels. We all lived through the horror of the opioid epidemic in the US over the past several years, over the years actually preceding the pandemic. And right before the pandemic, we were making headways, we were making some improvement in curbing or reducing opioid utilization in the United States. It became such a big issue, there was a lot of spotlight on it, physicians and organizations started sort of putting the lid on it and trying to curb or reduce opioid utilization in the United States. And the pandemic hit. What we've seen now is that people with COVID-19 are being prescribed more and more opioids. And that's not really to say that pain should not be treated. Obviously, most of opioid prescription, or actually nearly all, would be for the treatment of pain. So we realize that a lot of people with COVID-19 suffer from lingering symptoms and lingering problems for weeks or a month or years on end. And then that pain or those symptoms need to be treated. I think what we're saying is that we see signals now increase opioid utilization in these patients. We need to really pay close attention to it to really prevent it from becoming another opioid epidemic down the road. So it won't be like another deja vu, like, oh, we're like replaying the tape all over again, and resulting or precipitating in another opioid epidemic down the road.
What about alcohol use? Where does that fit in, if at all?
So we've seen, in the risk of mental health disorders that we reported in people with COVID-19 encompasses many categories, including, substance use disorders, including alcohol use. And so we see that. And it's really a manifestations primarily of the stress that people are having, of the anxiety, the stress, of the, in some people, it may be one of the coping mechanisms. And I think that's really also very important to pay attention to, and to really, identify those patients and help them, help nip it in the bud, so to speak, to try to prevent it from becoming a much more serious problem down the road.
Okay. Well, now, those people who were mental health patients, were they admitted to a hospital, or were they referred for private care, or did it matter?
So most of these patients are actually treated as outpatients, so they're treated in physician offices as outpatients, and being prescribed those medications, be it antidepressants or benzodiazepines, or sleep medications or other medications. So most of these patients, the lion's share, are treated in doctors' offices, not in an in-hospital setting.
And is that a good thing?
Oh, it's absolutely a good thing. It's absolutely a good thing. I mean, with mental health, you always want to try to identify things early on and try to address them, quote unquote, nip it in the bud, to prevent it from becoming a much more serious problem down the road, where it would necessitate hospitalization or being committed to a ward or something like that. So certainly identifying these problems, or early identification of these problems, is going to be key to prevent them from ballooning into much larger crises, or much larger or much more serious problems down the road.
Okay. We'll get back to some other issues in just a minute. We'll be right back. And we're back. Doctor, are we looking at mass neurological decline because of this?
So what we've seen is that the absolute numbers are single digits, but when you really multiply that by the huge number of people who got COVID-19 in the United States, this suggests to us that we're literally a nation in crisis, or a sick nation, with really a lot of us have suffered COVID-19, and a good percentage of those people with COVID-19 are developing mental health disorders. So that's really, the numbers out there are sufficiently large to warrant really all of us paying more attention to this crisis now, to this issue now. And again, in the hope of identifying those patients early and treating them to prevent, these problems from becoming much larger crises down the road.
That kind of scares me.
It's alarming on some level. I mean, these are sort of we're beginning now to sort of like scratch the surface and try to understand what are the repercussions of this pandemic, what are sort of long-lasting manifestations of this pandemic. And it's clear it's not only infection with COVID-19 when you get, cough and fever in the first 30 days, right? So clearly there are long-term ramifications of this pandemic, or long-term consequences of having COVID-19 itself. We're beginning to unearth those, and clearly one of the major consequences of this pandemic is that it resulted in a lot of the people around us having mental health problems. And again, while the percentages, 2, 3, 4% may seem small to some people, if you multiply those by the huge number of people who got COVID-19 in the United States, that translates into millions of affected lives, millions of affected individuals whose life will be disrupted, for a while until they get the treatment and get back to normal. So I think it is, sufficiently alarming, and we definitely need to pay attention to it, especially the opioid, issues, or substance use disorder issues, depression, suicidal ideation, and all of those things are nearly the perfect storm for another suicide crisis down the road. Like we don't want to be talking in a year or 2 or 3, well, gee, why are people committing suicide, right? I think we need to raise.
So what do we need to do to be proactive?
So I think identifying those patients early. So for people who are listening or hearing this, if they have symptoms, or they have problems sleeping, or they have symptoms of depression or anxiety, seek help. You are not alone. You are not alone. There are a lot of other people like you. You are not alone. This is not something that you can nurse or treat at home. This is something you need to seek care for. And earlier is better than later. Identifying those issues early, again, is certainly better than leaving them, until they become much more serious problems. Now, for health systems, I think we need to understand this. For people who are running health systems, need to understand that COVID-19 is going to leave us with long-term consequences, and we need to have the capacity to be able to deal with those patients. We need to build capacity in our cities and in our healthcare systems to be able to deal with these patients. For the broader spectrum of policymakers, I think a recognition that COVID-19 isn't really just an acute disease that comes and goes in the first 2-3 weeks of illness, that it also carries long-term consequences, and making sure that we are attuned to those and understand those effects and address them at a population level is also going to be very, very important.
Okay. Doctor, thank you so much for your time. Appreciate it.
Thank you for having me. Thank you.
The goal of this segment was to help you understand mental health issues as they relate to COVID. We may have suffered through the pandemic for 2 years, but the effects could be long-term, maybe a lifetime. Mental health issues should not be shadowed diseases. There's no shame in seeking help. Live your best life. I'm Sharon Stevens. Thank you so much for watching the Open Source TV. We'll see you again.